Okay. All right. Well, I tell you what, we need to go ahead and start the meeting. At this time, I'm gonna call the meeting to order, and I want to ask for can I get an adoption of the agenda?
I move approval of the agenda.
Okay, I second. All right. All in favor?
Aye.
Aye. Same here. Now, the next item on the agenda is adaptation of the minutes from the April 24th meeting, 2020.
So I move approval as distributed.
I second that motion. All in favor?
Aye.
Aye, same here. All right, item number 4, discussion and action items. John Andor, the first item on the for discussion is an update of the common operation, including the food delivery service. And John Andor and Larry will take that. John, you want to start it off?
Yes, Mr. Chairman. I've provided you some photos of some of the activities that have occurred this past week with the food delivery in your packet. So hopefully you had an opportunity to see those. And two things I'd like to focus on today is just or 3 things: how operations have been as of late, and then how the food delivery has been going since this is our first week, and what we have upcoming for the next week. And then third, I also like to talk about bus cleanliness, as that has been a recent concern from some of our passengers and common administration. And I'll ask Larry to go into details about each of those 3 items. So Larry, if you could.
Yes, sir, John. About the food delivery, we started this week delivering meals in conjunction with senior services. That went well. We delivered 76 meals this week, and we're going to be working off that same list of people that we delivered this week, and we added 14 more, so we anticipate 90 meals to be delivered next week. We are also looking to add deliveries for Able, grocery deliveries, and Axiom. Yes, I'm sorry, John. Axiom. We had a meeting yesterday with Axiom Farms, and we're going to be assisting them with delivering groceries to apartment complexes where we would pick up the groceries and then deliver them to a kiosk that they will be manning. And what we will provide for them is just getting, loading the groceries and then getting them to those locations so that they can distribute to the people there. But that seems to be going well. My drivers didn't have any problems this week delivering the meals. In fact, they kind of enjoyed it. So we're just going to see, like I said, we've already added 14 more for next week. And if they continue to need more service, then we will do what we need to do on our end to make sure that we can provide that service for them.
So the list comes to you, Larry, from Senior Resources. Is that where that comes to the comment?
Yes, ma'am.
Okay, and then with the addresses, and then you just pick up the food at a designated place and deliver?
Yes,
in one of the DART vans? Okay.
Yes, ma'am. So what we do is we take that list, we schedule them for delivery with anticipated delivery times. We send back those times to senior services so they can call those people and let them know when they can expect their deliveries.
Oh, good. That sounds good. Well, I'm really glad that we're able to do that.
As am I. I think it's a good service.
Yep, great. So, but you pick these foods up someplace like Walmart or Fallow someplace, and they've already been paid for, and just take it out to the customers. I mean, to these centers. Is that the way it was done? I'm just curious how it's done.
So the meals that we delivered this week were prepackaged meals for the week. So each package for each individual had 5 frozen meals, and then some, vegetables or fruits and vegetables for them, fresh produce. So that's what we delivered this week. Next week we're looking to be delivering groceries.
Mm.
Yeah, that's what I was wondering. And the groceries would come from under the stores like Walmart or someplace, or
Well,
where
Axiom,
would it?
right. So we would be picking up from Axiom Farm, which is it's a co-op, right, John?
That is correct.
So
Okay.
we would be picking up from there. These people would pre-order their food, and then we would pick up the orders, deliver them to, like I said, this manned kiosk that they would be manning. So, like I said, we're
Hmm.
just providing the transportation from one place to the other.
Sounds great. Sounds great.
Yeah.
You know,
Yes. Yes.
that'd be very helpful, especially for people who can't get out and help out. Okay, John, you want to add anything to that?
No, I'm just pleased with the service. We continue to reach out to others that may want our services. We can do this service through August 20th of 2020, or when we resume full normal comment service, whichever comes first.
All right. Sounds good.
Mr. Huggins
Okay.
is on the line. Do you hear him?
Okay, Derek.
Yes.
Welcome aboard. We're on item. We just finished update of the comment operations, including the food delivery.
Well,
so
we
that's
hadn't
item
heard. We
eight.
talked about food delivery, but we hadn't heard about the general operations. I'm sure he has more to say
Okay.
about that.
Yeah,
think.
yeah. We're on item 4A right now. Go ahead. Okay. But anybody else? You got anything else to say about the operations? You did say that.
So Larry, talk about how operations have been.
Okay, so we are continuing to supply all of our employees with PPE. Still encouraging social distancing with our operators. Right now, we are getting ready to install temporary barriers on the small cutaways because we don't have the ability to allow rear boarding like we do in the bigger buses. We did a mock-up for John and he liked it. So we are just in the process of getting those supplies so that we can put them on the dart cutaways that we have in service, so that it's just what it is. It's what it amounts to is it's a shower curtain that is a barrier to so that when people are getting on and off the bus, it's this physical barrier between themselves and the clients that are getting on and off the buses.
And board
Well, and I appreciate your sending I appreciated you all sending pictures because that was hard for me to envision. But so the picture helped a lot.
Okay, just want to make sure you saw the pictures in your packet.
Yes.
Yep. Very good. Ingenuity. All right.
Yeah. We kind of took that idea from somewhere else, and I think John had seen it somewhere else, and we just came up with our own little version of it here, and I think it's going to work just fine.
And it's only costing us $329 per bus.
Okay. All right. That's small in comparison to what we were talking about.
It's a good interim fix until we can give you better cost for a permanent solution. So we'll keep you posted on that.
Right. That's good.
Well, actually, did you say $329 a bus?
Yes.
Because I thought the shower curtain part was significantly less than that. That the ones that we were looking at in terms of outfitting the bigger buses were closer to the $300 to $400.
Yeah, so we're only doing this on the smaller buses right now. The shower curtain's cheap. Well, the real cost is in the piping. We asked for yellow piping to just match the yellow stanchions on the buses.
Uh-huh.
So John, just let me jump in real quick. That price that I sent you, that's for all 20 setups.
Oh.
Yes, sir.
Well,
I'm sorry. I'm sorry. When I heard you say that, I'm like, no, because that price came in a lot cheaper than if we had bought them locally. We're able to get the yellow pipe, the yellow PVC, a lot cheaper than we were able to purchase it locally. So that's why it came in at that price.
So there you go. It's $329 for all 21 cutaways.
Correct.
Wow, that is a lot better. Wow, that's good.
That's about $12 a bus. Somewhere I'll say about. Okay. Well, that's great. Anything else?
Am I forgetting something, John?
Is there anything else with operations before we go into bus cleanliness?
Okay.
Well, so and what about ridership? What is that looking like? Do we still have a significant number of people riding?
Lexi, do you want to talk about ridership? Are you in a position to do so?
Yeah, I can talk a little bit about it. I'm still reviewing a lot of the information that has come into us from Urban Transportation, who's following all our APCs for us right now. Currently, our ridership is on average for what we've been seeing over the last 30 to 45 days. There hasn't been a significant increase or decrease. But we are continuing to watch the trends to see at any point if we have a downslide in our ridership.
So my recall is that we were, after all of the shutdown, that we were running about half of our usual ridership. Is that still about the ballpark?
I'm actually still in the process of reviewing that right now. I'm still
to know the percentages.
Yeah.
Okay.
Working on those
And then another question I had about that was that we talked a little bit about the difficulties with our homeless population who now can't access parks or libraries, and of I don't know whether it was actual or anticipated that some may just spend the day on the bus. What's the situation there?
I can't speak much to that. I know I haven't heard anything come up my way. Maybe Larry, do you know anything about that?
Sure. And Tanisha, she would be able to speak a lot more informatively about that. She is talks to the drivers and the supervisors on a daily basis. What are we getting from the procedures that we've implemented, like making them deboard at the end of the route and social distancing?
That part is going fine, but maybe about 10 minutes ago, as I was coming back up to my office, I had a driver that said that they have people on their bus now. Let's say if the bus driver exits the bus, or if the bus driver exits the bus for a restroom break. So once individuals get off the bus, they have been soliciting for money. So we're going to have to deal with that. But I just got that a couple minutes ago.
You mean soliciting other passengers for money?
No. If the driver gets off the bus, where everyone has to exit the bus, like for a bathroom break or a restroom break, and the driver steps off the bus, so everyone else has to step off the bus. Let's say if it's at we have design restroom stops, and if one of the restroom stops is at a restaurant, they will get off and go to people's cars asking for money.
So when the driver gets off the bus, everybody gets off the bus? Is that what you said?
Yes.
Oh.
Okay.
Well, it depends on how long. If they're doing a longer restroom, we can't lock them on the bus.
So he has to get off and lock the bus, and so they have to all be off.
Yes.
Okay.
But our restroom breaks are at approved bus stops.
Does that happen frequently, or?
No.
Well, one thing that I have noticed, and I've noticed this really ramping up in the last week or so, maybe a little bit longer than a week. There are intersections where every single day, and I don't remember seeing these people there before. For example, at Main and Elmwood, every day there's a group of people there when I go home. At the intersection of Gervais and Huger, there are people there, and it's all four corners. Like I don't remember seeing this before, but now the panhandling has ramped up immensely. So I'm sure that that's what these drivers are reporting.
Right.
Well, let me ask you now. You guys know about bus operation. Is that whose regulation is that? FDA or FTA or what? That everybody has to get off the bus. That's like a plane pull into a stop and everybody has to get off. I'm just trying to.
So what we did in relation to that is we're trying to discourage people from riding the bus continuously. We want people to have a destination because capacity is cut 50%. So by doing that, discourages people who let's say, board on the wrong side of the street just because they want to ride around to get to their destination. It encourages people to board on the right side of the street. So that's why we're doing that at the start of the route and at the end of the route.
End of the route, yes.
So if somebody gets inconvenienced because they were forced to get off the bus, they'll think twice about doing that again the next time. Of course, there's exceptions to that rule when buses are on a one-way loop, for instance, and there is no possible bus stop for somebody to cross the street to catch the bus on the direction they want to go. But that's on a very limited number of routes, on very limited occasions where that's been a challenge.
But John, I thought Larry said if the bus driver has to stop for a restroom break or something, everybody has to disembark.
There's also that as well. So it's a two-tiered situation. Everybody disembarks at the start and ends of bus route, and they also disembark when the bus driver is not on the bus for whatever reason.
All right, so let me ask you this. One thing we also talked about, well, it's been 2 weeks ago since I wasn't here last week, was the possibility, Derek had asked if there was something that we could do to keep the drivers at work who have been furloughed. And one thing we talked about was whether we could have, I mean, it's like two drivers riding a bus. I mean, we'd be paying them the same because we're paying the furloughed employees. And so, I mean, somebody's paying the furloughed employees, I guess, out of our emergency funds. But I wondered if having the second person on the bus might be a relief to this situation too, so that when the driver needs to take a break, there's still an official person on the bus, and we wouldn't have to make people get off.
Well, the reason why
how far-fetched is that?
So the reason why we want people to get off is because we don't want people to just continuously ride for no reason. So this is just
well, I get that. I get that at the beginning and the end of the route. I'm talking about these stops along the way, and that was what I was worrying. That was what I was wondering about.
Are we disembarking people from the bus when the driver needs to use the restroom on the middle of the route, Larry?
No, this one just so happens at it's one of the end of the routes. This one happened at one of the end of the routes, so no.
Oh, I thought I misunderstood then. I thought you said every time
when
the driver has to get off the bus, he has to lock the bus, and he can't lock people on the bus, so everybody has to get off.
Right. No, this was at the end of the route, though. I'm so sorry. I did, but it was at the end of the route.
Okay. I got you.
Okay. All right, then, good. That sounds better, because I was starting to worry about safety problems and somebody getting hit by a car and all kind of stuff, you know. But anyway,
and that we're creating a group right off the bus too, so the social distancing is harder.
Yeah. Now, along those lines, one last question from me: are our passengers riding? Are they using masks? Do we enforce or ask them to use masks, or how are we doing that?
So on the mask issue, because the governor has not issued a state law mandating masks or an executive order, we can't enforce people to use masks. We are doing marketing in conjunction with DHEC in relation to encouraging people to do masks, and we actually had a discussion about this yesterday. TransDev will also be doing the same for its employees, but we can't force people at the present time. Some states, governors have issued that order, and therefore it's mandated, like California is a good example of one, but South Carolina is not at this time.
Well, John, in our participation with the governor's staff and the rest of the emergency planning folks, could we propose that he include in the ordinance a requirement that people riding public transit wear masks? Because I think that's an appropriate thing if it's a public service, and it's one that we can't avoid having people have some contact, even though we're trying to do the other things to keep the space, that wearing a mask is an added protection that seems reasonable to me to be included in the ordinance. Could we propose that to that emergency planning group?
We could propose it. I'll ask Mayor Coble if he's able to propose that through his channel.
Yes, he might run interference on that for us, right?
Yeah.
Okay. That would be good.
That'd be good. Okay. All right. Anything else?
Just continuing on this subject, you also have a copy of the executive order that the governor issued last week that basically started to relax some of the non-essential businesses. So you may have noticed that there's starting to be a little increase in traffic and people being out and about because of the relaxation of the executive order. He did extend the state of emergency to May 11th. So at the present time, we're still continuing to operate the transit system as approved by the board, consistent with that state of emergency. And we'll be watching to see if he does another extension or if we go back to normal. I've also attached in your packet on page 31 a matrix that our planner put together that we're starting to have the discussions about if the governor releases that state of emergency, we need to ramp up to get back to normal service. So there's going to be some processes in place to determine how do we ramp up. That includes watching to see what the city of Columbia and Richland County and Lexington County does. Drivers have been out of work for more than 30 days, so Transdev will need to possibly do some drug testing again, retraining, and make sure that they're fit for duty to come back to run service. Then they'll have to do another driver bid, which is consistent with the union agreement, since this is the time when they normally do a bid anyways. And then then we'll have to go and clean all the buses that we haven't been using, and then we'll be ready to go back into regular service. So I anticipate that it'd be about a week to a week and a half ramp-up period before we can just resume normal service after the state of emergency ends.
Well, John, I found and Eric, I found that chart very helpful to have all of those, what we are doing and what would change under each one of those situations. That's very helpful to be able to see that all in one picture. I'm glad for that. And I was looking at the one that talked about the negative impacts from removing social distance guidelines. Do you have any idea? I mean, I know that would need to, I guess, come from the governor's office if they are spotting negative impacts when they reopen. But it's really hard for me to understand what they're going to be looking at, because they've made this decision while our infections and our deaths are still going up. I mean, we're not reopening the services, not just transit, but other services, in the face of a decline in the epidemic. We'll open it while we're still going up. So how do they decide that what's having a negative impact?
And I think, I know from CDC and the federal government, they're relying on the governors to make this determination. Some governors, like I'll use California as a good example, they reopened beaches, and then in one case, one of the beaches got 80,000 people, so the governor immediately took back that and closed the beaches again. So I think this is going to be an ebb and flow type of thing, depending on how people react. In the case of us, because people are confined in a small space, well, we're more likely going to have to make some prudent decisions, which I would presume this committee would make recommendations to the board on how to address social distancing until we are 100% comfortable that we can get back to normal. Because obviously, if we get back to normal service and we don't address the social distancing, we're going to have another issue on cost, because we're going to have to add more buses to the system to be able to transport the same level of people we transported previous to COVID-19.
Well, I did just read a study that was showing, and I can't tell you the methodology exactly they used, but they were looking across states and then within counties in the state about how well people were practicing social distancing, and both Richland and Lexington counties got an F, a failing grade on social distancing. I think we only had one county in the state that was a B and no A's. So I'm concerned about. I mean, and I'm saying, this was was one analysis, and I'm not sure of what they were using, what their criteria, how they were measuring that. But it made me uneasy to think that we are in an environment where people may not be practicing this very carefully now.
Okay, John.
Derek, go ahead, Derek.
Okay, and I agree with Lil 100% because, you know, we hadn't even reached the apex yet, and you're talking about confined areas, and I keep driving this back home saying we don't have the luxury of being able to absorb any kind of spike on the bus because, one, you have your drivers, and we have a limited number of drivers. If the drivers go down, the bus system goes down. So with the COVID $16 million that we got, and I don't know how much have we spent so far, John?
Of the COVID money?
Yes.
I'll have to report back to you on that during in the next 2 weeks, because we need to reconcile back to January 20th of what we paid Transdev, and then of course any pass-through expenses that Transdev gives to us.
Okay, my point is that not so much reconcile. We have to appropriate the resources for what is to come. So I agree totally with Lil. We have to ramp up the number of buses so we can continue with our social distancing. And then eventually, what's going to come time is essential workers. And we're going to have to figure out how we identify essential workers, because I don't see this going away. And I don't see this going away anytime soon. And if, again, another spike comes in September and our drivers are down, then we don't have a bus system. So please come up with a plan, or at least in your thoughts, how we do this in the future, okay?
Well, one question might be, are we testing our drivers now? Do we know the status of our drivers now in terms of infection?
We've not started testing our drivers as of yet. We did get, Tanisha got one quote on testing, which is $125. Tanisha, do you want to talk about that?
Yes, SC House Calls, what I've been talking about on previous calls.
Yeah.
SC House Calls is in West Columbia, and they offer the coronavirus tests. They offer testing of the antibodies, and the tests are $125 per person. You don't need a doctor's orders, or you don't have to show signs or symptoms. We've learned that if you have Medicare, Medicaid, the cost is covered completely. For any employees covered by PEBA, the policy has been mandated to pay 100% coverage for coronavirus testing. Now, what we're trying to do is get tested as a group. They'll send a nurse practitioner over. We set up the time, the testing time, the supplies and the date. They have enough tests for all of us already. And they'll send over a nurse practitioner and a physician, and they'll actually come here and do the testing for us.
Oh, well, that would be ideal. Now, I have two thoughts on that. One is that I've been reading that some of the, I don't know whether it's urgent care, but one of those systems like that now is offering that on a doctor's care, offering it on a walk-in basis. So it might be worth getting a comparative cost from them to see what they are doing and at what cost. That might be good.
I can get a cost, but for doctor's care, we needed orders from a doctor.
Well, they
I already
are
spoke
the
with someone
doctors.
on the phone. I know, but it's an urgent care facility, and they won't give you the test until you have an order from a doctor, or you've been directly exposed for, and you already have forms from your doctor. So,
and then the other thing is that I know that they're doing some antibody testing around the country, and I'm really grateful for that. I don't think those tests are. I don't think they're completely happy with how reliable those tests are.
Right.
But I'd be happy for us to be part of that, because I think that's an essential ingredient in all of this, deciding what's safe and what's not safe, and who's safe and who's not safe. So there's a lot more for us to know. But I think the more that we can contribute to the testing data, by testing our folks both benefits our drivers and benefits the public health system, because I want us to report those tests to DHEC so they get a picture of what's going on.
Okay.
We did
John,
have.
John, that's good.
Oh,
Good, Leo. Let me ask you one quick question. John, on the possibility of getting someone to come out, this company you're talking about over in West Columbia, come out and do a test of everybody at one time, what would we need to do, or what you need to do to make that happen?
I know Leroy is also verifying with the same company that the City of Columbia is using. Once we get all the costs together, we're going to have a conversation with TransDev in relation to how do we share these costs if necessary, and then we'll present a recommendation for this committee to recommend to the board on testing.
Well, okay, that sounds good, and maybe we could have something. We need to go ahead and do this as quickly as we can, I would think. So,
I'm hoping that we can have information to you by next Friday's meeting, because that will be timely
and
for the committee.
I have one more suggestion, and I'm thinking about our the DHEC representative that was on our call 2 weeks ago, and it may be worth just calling her and saying, this is what we're trying to figure out how to do with our drivers, and this is what we have found so far is available to us, and see if she knows of any other alternatives, whether the public health system itself is trying to do some of this in order to be able to ramp up the testing. So I'd run this by her just to see if she knows of any other ways people are doing this.
Well,
yes.
That sounds great, but I was just thinking the other day, you and I need to be back over there at DHEC. Looked to me like.
Well, I'm trying to stay in touch with people as much as I can, and
Leo, what I'm saying is that they're doing some things over there. They didn't know where all these people had passed away in this nursing home. They didn't know about it and all. So I'm just thinking that's a good idea what you're saying, but if we have somebody, and especially with the amount that they're talking about charging that be covered by Medicare and Medicaid, we probably don't have to wait, because if we get tied up in the DHEC system, no telling when we'll get it done, if we ever get it done. Well, I'm
not talking about calling them and asking them to come do it. I'm just saying I want us to tap into what they know about what's going on around and whether there are other places that are trying to work on the same kind of issues for their employees and what they're using. I just think they would have a broader picture of what's happening. Now, I will say on the unreported deaths, the DHEC death reporting is dependent upon the places and the physicians and the facilities where people die reporting those deaths. So when they don't get reported, DHEC doesn't have them, and so it's after a while they'll show up because people have to have a death certificate to bury people and stuff. But I understand how that delay can happen if you've got a lapse in reporting from the people who have to report in.
Okay.
I've been in contact. I'm sorry. This is Tanisha,
Caroline.
and I've been in.
Wait. Okay.
I think Tanisha was talking, and then Mr. Huggins was next.
This is Tanisha. We've been in contact with Monica Taylor from DHEC, and she's putting out some resources also, but she said she's running into the same problem that we ran into at first, where you need a doctor's orders or you need to show signs or symptoms to be able to receive the test.
Participant is now exiting.
So she's still working, and she contacts me if she has any other updated information, but we are working closely with her.
Well, I'm glad, because it seems to me they would have more influence in being able to get the ordinance to waive having to have a doctor's order for a test. I mean, for gosh sakes, if they can waive giving people a drive-in test to get a driver's license, they certainly can waive having a doctor's order for a COVID-19 test.
Right.
And the state health department carries a more weight to ask for a waiver on that than we do.
Okay. But okay. Derek, did you have something to say?
Yes, sir.
Derek. Okay, go ahead.
Yes, sir.
Go ahead.
Okay. I want to get back to the point that 10 minutes ago. I'm more interested in making sure our drivers are protected, and then when the time comes for essential workers and the capacity of what we can move, how we have a plan available for that. And I know we have to be very careful, but just like New York had to do the subway situation with the homeless and all that, I just think that we need to have a plan, and our Richland and Columbia leaders and Lexington leaders need to know that we're here to protect our riders and our drivers in case that we have a situation where we're not able to operate the buses with infected drivers or drivers that may be sick or whatever. So that's what I would like to hear from John and Transdev. If we were to hit ground zero, what's the plan for ground zero? So that's where I want us to be, ahead of the time.
Well, and Derek, I would echo that, because I think we're talking right in this last little while about how do we take the first step of testing, but then you got to know, what are you going to do when you get the results of the test? Are we going to say, all right, if a driver's test comes back showing they're infected, do they have to be in quarantine for 14 days before they can drive again? What about the people who they've come in contact with? How are we going to follow up with them? I mean, the testing is just the tip of the iceberg. Then you have to say, what do we do with the results of the test, and how will that impact the services and, as Derek points out, the protection of the people both driving and riding?
Yep, you got that right, Lil. That's right. Well, John, I guess at this juncture, then, you're just taking what Derek has just said, taking that information in, Lil, and maybe see if we can come up with some kind of a plan how we would do that in the event. Now, I do know one thing. You're talking about getting down to ground zero, Derek. Our big thing is to try to make sure we don't get to that point by taking all these precautionary procedures that we're talking about. But if in the event we do get there, then we got to have some kind of plan as what we do when we get there.
Yeah, because we're dealing with a lot of unknowns right now. We just don't know how many people already in our staff may have be infected.
Yeah.
Right.
So, but okay.
I agree, Colonel Leach. I definitely don't want to get to ground zero. That's not where I want to go. But at the end of the day, I do want us to be in a situation where we plan accordingly, introduce all variables in the equation, and balance this equation so we don't get to ground zero.
Mm-hmm.
Exactly. All right. So let's summarize this now. Let's bring this to a close here. Where are we now? What do we need to do? You're gonna try to get some people tested. You're gonna check.
Yeah. So we need to get a plan on how we're going to test employees. Employees, whether they work for the Comet, whether they work for Transdev, or whether they work for Transport Care Services. And then we need to, once we've got those costs, then we need to determine, is it appropriate for the Comet to pay for everything? Do we need the contractors to pay for a portion of this? And how does that look at? And then we would like to present that to this committee to approve or not approve. And then once we have that approval, then we can implement shortly thereafter.
Okay, sounds good to me.
Just to have an idea, from an order of magnitude, if the COVID took on that entire cost at 125 times 225 people, we're about $28,000.
Okay.
Well, that certainly seems appropriate. Expenditure of funds for additional COVID costs. That if that's what our
that is definitely an eligible expense, and I think just for the business side of it, we just need to make sure we have an understanding on
how that gets done.
The responsibility. If there's a desire from this committee that you'd rather the Comet take on the responsibility, you made my life easier, and we can report next Friday with a final cost for your approval.
Well, John.
Well,
if
and,
that's
and, and aren't we in the same situation of where what all that we can do is recommend for board action? Is that how that works?
I believe this committee, if I understood the action, is authorized to give a staff direction, and then any recommendations will be carried forward at the next board meeting for retroactive approval. In light of the fact that we have a lot going on.
Because as you were pointing out, it all does have financial implications, but
Right.
also
The
we're working against a time
my-
frame that we can't just mess around. Right.
Right. The 28,000 is within my spending authority, but I think for the purposes of what's going on, that's why this committee was formed, to just make sure that if there's a subset of the committee that supports these actions, then I don't think the rest of the board will have any problem
with that. I don't think so either. Okay.
I think we need to take that direction. Okay, then. Good. So we don't need to do anything. Just go ahead and John.
Wait to hear from them next week. Yeah.
So next Friday we'll have a plan for you guys to approve.
All right.
Or consider approving.
Well, okay, that sounds great. So we know what we want to do now. That's item 4 Bravo we were on, right?
Yes.
That's we kind of morphed into A and B. So 4B, we're still talking about that. Any other discussion on item 4B, reopening the comment after the COVID-19 situation is over?
No, didn't somebody mention earlier, Colonel Leaks, that there was something to report about cleaning the buses too? Did we skip over that?
Yes, that's the last thing. And Larry, please talk about our meeting and your action plans for ensuring that our buses are being cleaned and what actions you've taken since we talked on, I believe, Tuesday.
Yes, sir, John. So it was after we gotten complaints about dirty buses, I went out and spot checked 22 buses last Friday morning and found lots of dirty handrails among, that was the biggest defect, if you will, but that was the biggest thing that we found. John did another spot check on Monday night. Correct me if I'm wrong, John. Tuesday morning?
Monday night, Tuesday morning, yes.
Okay, and he checked 20 buses, I believe. And again, dirty handrails, dirty seats. There were lots of things that John, we and John felt like needed to be addressed and addressed aggressively. So what we did was John and I met with the subcontractors for deep cleaning and for the service line. And we spoke to them about our concerns and how that they were not meeting the expectations of the contract. And because of with the situation that we are in right now with COVID-19 and the importance of us cleaning the buses to the level of the contract and then being able to disinfect them as well, we impressed upon them that we needed to make changes and we needed to make sure that we were doing what we needed to do to make sure that the buses were clean and sanitized for the safety of everyone involved, operators and passengers. So after this meeting, we made a determination to terminate the service line supervisor who has been reprimanded or talked to about not meeting the expectations of the cleanliness on the vehicles. So we have taken that out. We have asked both subcontractors to come up with an action plan to rectify this problem to make sure that it does not happen again. We had them submit standard operating procedures for the cleanliness and cleaning of the buses, the facilities, and the bus stops and shelters. And in addition to all of that, my management team, starting with my inspection last week, will be checking the buses on a random day of every week. We will be checking them once a week. We will continue to check buses with my supervisor, AM pullout, and an employee from TCS is going to be spot checking these buses as well, because we need to make sure that these buses, like I said, are being cleaned to not only the specifications of the contract, but because we are living in the times that we are living in, that these buses need to be cleaned and sanitized for the safety and health of everybody that's getting on and off that bus.
Well, I think the goal is right, but here's my reaction. You know, if we've subcontracted with someone and their contract is to clean the buses, we don't need to ask them for a plan for that. We need for them to do it. They've already said they've already signed up and getting paid to do it, so they don't need a plan. They just need to do it. And my second reaction was, I'm not sure random spot checks once a week is enough at this point. I think we may have to really dig down and have somebody looking at those buses every single day until we have a satisfactory period of time, at least, that we can be sure that what they've been paid to be done is being done. And so I don't know how you assign that, but it seems to me the kind of thing that you are doing and John are doing, I mean, we ought to have somebody that ought to be their main job every day is to inspect the buses that have been cleaned and be sure they're okay to go out the door. Now, I mean, that's my opinion.
That's good point. Yep. We need to
Ms. Moon, and I agree actually with what you're saying. We can work with TransDev to amend some of the documents. The reason why I asked for a plan is I wanted in writing that they acknowledge that there was a deficiency, that the deficiency is unacceptable, and that we need something to hold them accountable to. And I know that we have
that's fine to get that in writing. I just didn't want them to go into planning mode. I just getting what you've covered in writing, I think is essential, but it's not
agree. We should have somebody that signs off every bus that is cleaned daily until we get out of this situation. And maybe it certifies that the bus is actually clean and ready for service. And if it doesn't pass the test, they keep cleaning until it passes the test.
Exactly.
John, you know how to make that happen. Good point, Leo. All right. Anything else? Okay.
Colonel Lee.
Yes, sir.
I just want to. I think the committee that we put together and participate in really gives the CEO an opportunity to vet some things from a board perspective, so he can be much more ready to get with other board members at our board meetings and have a broad perspective. So I really do appreciate you chairing this, and I appreciate Ms. Mood also. So I think John will really be in a situation where he benefits from this.
And it puts us in a good position to be able to be supportive to him too on things that come up. Yeah.
Mm-hmm. That's good. Appreciate that input. And but one final point I want to ask before we go, John, in reopening, I'm just wondering how will we work the situation with the furloughed people and the people who are on unemployment and the people who are getting that extra $600 a week. I think that's what they're getting. I'm sure you have a plan how we're going to reverse all of that and get that back to normalcy, right?
Yes, that's what Eric is working on, and then we will be coordinating with TransDev in relation to how all that works. But there will be some processes that will need to be implemented before they can merely come back to work.
Okay. Well, thank you very much.
Okay. You need a motion to adjourn?
No other comments? Then yes, a motion to adjourn, please.
I so move.
Second.
Properly moved in second. All in favor?
Aye. And thank you all. Bye-bye.
Thank you, Mr. Chairman, members of the committee. I wish you a great afternoon.
Thank you. Same here.
Bye-bye.
Okay.
Bye-bye.
Is now exiting.